Hello, 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 and welcome to the Julia podcast. My name is Chris Rakakis.
And I am Michael Tiemann.
I'm just so excited because we got someone this time that they also want to do their introduction, right? So, Jacob, do you want to do your Twitch introduction?
Sure. Well, hello, everyone. My name is Jacob Zelko. Good morning, good evening, good night. Welcome to the podcast. So glad to have you here.
Woo! All right. See, so Jacob, if you didn't know, he does actually he does some Twitch streaming, and he does some a lot of things in the Julia community. In fact, we should probably give the entire introduction here, right? Should we just read the Jacob Scott Zelko is a master's student in applied mathematics at Northeastern University and a trainee at NEU's Roux Institute. Right. Additionally, he is the present chief of global health informatics at a Brooklyn-based nonprofit, the One Fact Foundation. Oh, I actually didn't know that fact about you. Prior to this, he has worked for a couple of years as a Georgia Tech Georgia Tech Research Institute. I can't read out in an excellent heat division as a health data analytics and informatics researcher, headed by Dr. John Duke, and as a research engineer for the Centers of Disease Control. So, couldn't tell, he's done a lot with disease modeling. During his undergrad, he also worked at Emory University's Department of Biomedical Informatics as a data information specialist. And in the Julia community, he is a leader for the JuliaHealth organization, a community of Julia developers who use the Julia programming language to improve medicine, healthcare, public health, and biomedical research. It's a pretty fancy resume you got there.
This will be in the show notes, right? So people will read this if they want to. Jacob, tell us about yourself. You are currently a master's student in applied mathematics, and yet you are speaking on a software podcast. So what have those two things in common for you?
That is a great question. Thank you so much for having me on the podcast. Super excited to be here. For me, I see kind of the two as, interrelated. Sure, in applied mathematics, people might jump to thinking like statistics, or especially like right now, machine learning or data science or these sort of other roles. But for me, applied mathematics is actually a very strong combination of a lot of both pure maths as well as applied mathematics. My research is as Chris was mentioning, as you were mentioning, is a lot in public health care settings. But then I'm not afraid to delve into pure maths as necessary. So for me, it's a bit of a mix of different things within my program. And I'm actually graduating just this Sunday, so I will be no longer a student, but I guess I will be a master of applied math. So there's
well, master of math. All right. It does say here applied math. Okay, cool.
Yeah, if you want to be specific, a master, if you will. So I will be.
Ooh, all right. I think we gotta cut the show right there. Thank you, everybody.
And so, if you're graduating on Sunday, what will come next?
Yeah, it's a great question. So next year, planning to take a gap year. I'll be looking for kind of like short-term, contracting, as well as just kind of continuing with some of my ongoing applied mathematics research, both within public health research, as well as in the mathematics of applied category theory and some pure maths related to like sheaf and topos theory. And then over the next year, I'll probably be reapplying to some PhD cycles and PhD programs, as well as, looking for maybe even some full-time employment opportunities. So that's the plan right now.
All right.
Yeah. So a lot of what you mentioned coming up is a lot of math. Where does the biomedical part come into that, right? Are you saying goodbye to the biomedical world? You're like, okay, we're going to lose our human bodies in the near future anyways. We're all going to become robots, so we don't need any of this biomedical stuff? Or is it going to be incorporated into the mathematics that you're going to be working on?
Yeah, no, it especially is actually, like I was, saying, like, even though my research might skew more towards, in some senses, pure mathematics, all my applications and specific domain applications will be centered around various, health and health informatics sort of questions. So I guess maybe to like provide the framing and the context for where I got to today, in my mathematics, studies is, when I was working at the CDC, when I was working at Georgia Tech, I encountered a lot of various sorts of problems, especially from a public health surveillance side. I was employed at the CDC at the height of the COVID-19 pandemic, actually I joined our teams both at the CDC and Georgia Tech right when the vaccines were beginning to roll out, and the variants were also starting to emerge. So there was still that huge, confusion of what we were doing in a lot of ways. And so it was through these kind of problems that framed a lot of my thinking and approaches of how we want to maybe think about formalizing some of these, questions that I was asking from an engineering role in more of a mathematics paradigm or setting.
And when you say more of a mathematics paradigm or setting, what kind of mathematics are you poking at there? Because I think that you have a very spicy take on what kinds of mathematics should be applied or could be applied, right? Can you give us some of this? Can you categorize your spice a little bit?
Yeah. I see where this is going. Yes, absolutely. So I'll just be very explicit with saying, my research in pure maths is really centered around mathematics of category theory and kind of the adjacent fields of sheaf and topos theory, although those fields kind of can be of their own, they can exist of their own selves. So I've spent a lot of time in the last, I would say, almost 3 years really delving deeper into category theory as best as I can. Something to emphasize to folks here listening, if I don't sound as rigorous or as mathematical as you might be expecting as someone who is, graduating with a degree in applied mathematics, or graduate degree in applied mathematics, is that my undergrad, I was actually coming from a biomedical engineering background. So, I'm still delving into this, still so much to learn here, Chris.
That's all right. If you get any theorem wrong, we will burn you. But
I expect nothing less.
But I mean, talking about category theory, 2 questions. So one is, isn't that all abstract nonsense? And the second question is, well, like, once you're dealing with abstract nonsense, how did you come to work with Julia as your weapon of choice as opposed to Haskell?
Yeah, so I think I'll answer the first question, which was like, if I can rephrase it, just to make sure I understood your question, Michael. First question was more like, why category theory a little bit, if I can rephrase it, or why was I drawn to it?
Everything about that. Yeah,
I wasn't being too sincere, because the abstract nonsense is, I think, what the non-category theorist people refer to as category theory. But I mean, if you want to, I mean, you can share.
Yeah. So it's kind of funny because your 2 questions here are kind of orthogonal in a way, but they do come back in a strange way that I did not ever expect to happen. But
okay.
The first sort of answer to the question, what drew me to this? So as I was mentioning, going through the COVID pandemic, being involved with a lot of like the national United States responses, and being in a ton of conversations around this, I was specifically working in support of the Office of Science Mitigation Policy Analysis unit at the CDC. And through that experience, we were kind of in the situation where we were working with our colleagues and our counterparts at the CDC, both, at CDC and at GTRI side, doing all sorts of different sorts of analyses, what could be going on, what are the effects of certain policies, what can we observe. At a certain level, we could only find time to do almost, in a sense, descriptive level statistics, like almost very similar to just, kind of your basic sort of data science type of workflows. But that was because in a given day, we might have like 3 or 4 requests come in at a time. We'd ask for we'd be asked, could you do this analysis? We do the analysis, send back results midday, get asked to do another thing. And potentially, we'd have that going on multiple times throughout the same day. So there was really not a moment for us to breathe so much. And so for me, I oftentimes felt like if I had a moment to think, really, I felt like I was kind of in the situation of having being in a ship that was somewhat sinking. We had hit something, it was sinking, and, we're rapidly trying to bail out the ship that's sinking with a pitcher or a jug. And we're trying to bail it out, but we realize the jug has a hole in it. So it's not very effective at all, but, we're barely just doing enough just to be able to get ourselves safely to shore.
Yeah, I think
honor citizenship.
I understand that feeling very deeply. It's May 2025 in the United States, by the way, if anyone's listening to this in the future. But go on.
Yeah. Yeah. And so you're just doing everything you possibly can to get yourself to shore. And really, for us getting to shore, for me getting to shore, was when, probably around like 2022, 2023 kind of rolled around, where finally, things were dying down in the pandemic. Our response work was starting to, level off even more and more and more. I could start thinking about other projects. And I began thinking to myself, like, man, if only there was some way or some option where we could be in the situation, if we had to be in the situation again, it was like there could be something like a bilge pump or like a water drainage pump baked in or built into my ship, such that if we ever got into the situation again, I could flip a switch, and although the ship would still be in jeopardy, I would have a lot more mobility and flexibility to think around the problem and navigate safely to shore instead of this frantic sort of, oh my gosh, what are we doing? And that was where, in that sort of, this grappling period that I had, I was beginning to think to myself, like, oh, these problems that I'm running into seem really similar, but man, like, there's variations in the application or the implementation details of our solutions, such as what data we were using, what methods we were using, things that would subtly change how we'd want to work with our, analysis pipeline, but oftentimes take a lot of like labor intensive reworking or analysis, like reanalysis sort of work and discussion. And I thought to myself, like, could there be something more fundamental with these problems that somehow is like a kernel that is the same across these problems? And again, bear in mind, I'm an engineer by training at that point, and I was not really intuiting what I needed to talk about here. But I started delving into graph theory a little bit, like pure graph theory. I was like, could this be an idea here? And I was like, no, I felt like there needs to be something more fundamental. And the more I kept digging and digging and digging is when I started encountering, the mathematics of category theory and these levels of abstraction that, mathematicians love to talk about. And I was like, this is fascinating and very strange from how I think. So that's maybe I'll pause here, Michael, for a second, just to say, like, that's kind of where I first kind of had my first, brush with a pure mathematical way of thinking.
I mean, I'll tell you what I heard. What I heard is you're like, okay, I'm on a sinking ship. There's a whole bunch of water coming in, and you're like, guys, I've got a solution. It's category theory.
Yeah. So the interesting thing is, if I take it correctly, the CDC did the analysis not using Julia back then.
Oh, so that's an interesting point. Sorry for interrupting. I'll let you finish your thought, Michael.
If you would have had access to all the Julia tools that you have developed since then, would you still have been drawn to category theory, or would you say, okay, multiple dispatch solves all the subtle variants of analyses in a snap of a finger, and then like, okay, just more Julia and we'll be good?
Yeah, so it's pretty interesting. So at the time, I was using Julia all throughout my time while I was working at Georgia Tech and the CDC.
Mm-hmm.
Actually, I would oftentimes use Julia most days. Then, as needed, I delve into R. That was kind of like the other one I'd go into. Sometimes I'd use Python here and there, but mostly it was just Julia and R were like the main two that I would stick to. And then, honestly, the reason why, coming back to the earlier framing of, you asked these two questions of kind of what about this abstract nonsense? What drew you to this, and what about Julia drew you here, and stuff like that. So it's kind of fascinating because these are kind of two orthogonal sort of ideas, even though like they kind of seem related. I more or less kind of came into both Julia and category theory in a completely like orthogonal way. So it wasn't like I was coming into one language or coming into one paradigm and I just got exposure to one versus the other. It really was kind of just this happy serendipitous sort of event that I realized, like, oh, here's this mathematics and here's this robust ecosystem in Julia for, a variety of high performance computing needs, as well as modeling. And then, oh, look, they also do things with applied category theory. So it was kind of just a really kind of bizarre sort of confluence of events happening there. So maybe I'll pause there, Michael, to kind of give some clarity about like, what I was doing. So I was using Julia the whole time, I wouldn't change what I was doing, but I would definitely, you know, for future crisis work, I'd be very curious about what maybe new approaches or different sort of perspectives could be useful for these
Yeah.
sort of approaches.
Well, I guess my question there would be, what exactly about category theory is the piece that you started to say, like this part of category theory, if well developed and softwareized, would be the piece that would be the central element, so that way the next pandemic response is that easy, right? Like what is the piece of category theory that was kind of drawing you in to say, like, I really think that there's something here that will solve a real world problem if we get this right.
Yeah, no, I fully see what you're saying here, and this is kind of what when you were saying earlier, like, oh, I heard you. You're saying like you're on a sinking ship and you have this category theory, and everyone's looking at you kind of like, why are you running around with Saunders McLean's textbook right now, Jacob? What is going on here?
Mhm.
Like, I totally get what you're saying here, and I personally have the perspective when it comes to like what was the piece that kind of brought me into thinking like category theory could actually be really useful in sort of these crisis public health emergency sort of situations, as well as my thoughts around the next sort of major crisis that happens. Personally for me, what drew me to it as like kind of a guiding theme is the ability that I felt like category theory could be something that's more in the background, as less of a sort of, it's not going to, in my opinion, I don't see applied category theory or like a ACT type methods directly giving you like a novel statistic or something, but rather, especially as you want to think about maybe how we could use applied category theory for things like in data science or other sorts of applications or domain specific applications. I see the story that applied category theory can tell in these spaces as more of an integrating or bridging sort of perspective and story that helps you with your operations of whatever sort of operations that you might want to be performing with whatever modeling you want to be doing. So I don't see ACT as the thing that's you're doing the modeling with so much as it's the kind of framework or the environment to get you into a situation where you can just really fast and effectively implement whatever models or approaches that you want to actually work with in this context of a situation. And again, the reason why I like this idea so much was, and I'm sure Chris, I'd be very keen on your perspective here too, and Michael's is, I oftentimes see so many different research groups, doing different sort of modeling, be it with different languages, be it with different sort of underlying approaches that are differing. And even like, you can talk about how you have methods that are deterministic versus stochastic. And you might think to yourselves like, man, we're all working on the same problem here. Wouldn't it be great if there's some way we can either combine or, in my thinking, compose these different models together and actually give us some sort of big picture idea of what's going on if we're like all tackling the same problem. And category theoretic methods, I see that as somewhat the promise here, and it's still something I'm absolutely exploring and researching and reading a ton about, because there's a lot of still nuance to be done here in this space. But I think the promise that I see is from an operations point of view, maybe wearing an industrial engineering hat for a second, is that if I have like an organization where I have multiple different groups or small teams working on different aspects or similar modeling, like a similar problem, but different approaches all on the same problem, like maybe another pandemic or something like that, I'd want them to be exploring as many options as possible and trying out as different modeling approaches as possible. But then I'd love to be able to say, okay, taking this material back that you're receiving about each of these modeling sort of approaches, how can we compose this into like a big picture, what's going on across everything here?
Mm-hmm.
So
Mm-hmm.
that's kind of my hope, my aspiration. But
Yeah.
still
So I
need
mean, because
testing.
I've seen this a little bit, because I do know that, for example, James Fairbanks and his group, right, the group that does graphs.jl, right, they've built out a lot of this applied category theory stuff in Julia, where I've collaborated with them for many years, right? Where on especially on some DARPA projects before, and yeah, a lot of this idea comes down to things like, yeah, if you have a model for how well connected different places in the United States are. Let's say you have a model of, oh, here are the weights of how closely related things are by, people drive here, they don't drive there, kind of thing. And you have a model of, SIR model of pandemic. You can come up with something where you say, oh, the cross product between these two models is a pandemic across the United States, right? It can generate a larger model that has space and stuff. So I do get some of that. But I think the thing that really kind of I kind of curious about right
Yeah.
now is that, so it sounds like you say with your journey, you were at Georgia Tech
Yeah.
and you were using Julia for pandemic modeling, and then you wanted to go into category theory, and you want to go into category theory independently, and then you independently find that there's also applied category theory things in Julia. But the thing I also know is that the applied category group in Julia is actually at Georgia Tech, where you were. So how did you end up at Northeastern doing category theory in Julia when the people who do category theory in Julia over where you started? Is this just like a random coincidence, or like, what's going on here?
Yeah, it's definitely it's a weird winding story here. So I'll mention, but you are right. You're exactly right. At Georgia Tech at the time, there was an ongoing project that a dear colleague of mine at Georgia Tech, his name was Andrew Boss, was a part of, working with Dr. James Fairbanks. They were working together, and meanwhile I'm kind of off to the side, having my own journey of self-discovery while going through my pandemic response and everything, or the pandemic response that I was part of. At the time, Andrew would sometimes reach out to me at Georgia Tech, saying like, "Hey, Jacob, we want to make this visualization in Julia. Do you know how to make this?" Because I think, Chris, maybe one of the first times we might have interacted was not with anything health, or was not with anything category theory. It was when I was doing animations and visualizations in
Okay. Oh, yeah.
Gavis.jl. If
Yeah, Gavis.
no one,
Okay.
yeah, if no one here is familiar with that, this was a kind of mathematics animation engine that I co-wrote with one of my really great friends, Ola Kroge, over in, at the time, I was still at Georgia Tech Research Institute, and Ola, I think, was wrapping up his master's as well. We worked through developing this sort of animation engine very similar to 3 Blue 1 Brown's Manim engine, if anyone's seen that, which received a modicum of success here in the Julia ecosystem. Andrew knew that I was doing this sort of visualization work, and he reached out to me about these really bizarre visualizations. I'm like, what are these diagrams? And come to find out, these were commutative diagrams. These were Petri net diagrams. These were these other sorts of diagrams I had never really seen before. And before I knew it, I was like, Andrew, what are you working on? I got pulled into, that's when I kind of finally got pulled into that pipeline of the AlgebraicJulia ecosystem, talking with, folks at AlgebraicJulia, that community, the Topos Institute, and some other, institutions across the world as well. And so that's kind of how that finally, that all connected. But it was already like, I was kind of primed basically to hear hear the message of category theory, if you will, when I jumped into that, or got pulled into that by Andrew, just because I was like, these are really cool pictures, I want to know what you're doing. And little did I know that these are actually related to what I was slowly getting up to. And then Northeastern, like, how did I end up here? Well, that's I'll just tell in brief the story there. Was another hat that I wear, which, as we all know, is I'm also the leader of the JuliaHealth organization, which is very different from kind of these discussions around pure mathematics and some of these other discussions that we've been having around like visualization. But I do like things like population health research and health disparities, health economics, population health surveillance methods. I also do most recently I've been kind of getting more into oncology research and things like that. And at the time I was at GTRI, I was the principal investigator on a small grant with a couple undergrad research interns working for me on a international multi-site collaboration investigating chronic disparities in chronic mental health care across about 150 or so million patients globally. And I was receiving a lot of success through that work. We were able to do some presentations, some I think actually published works. Some of that came out from there, and then I was contacted by folks at Northeastern saying like, "Hey, we'd love it if you would join us over here at Northeastern. We would be happy to, pay for you to do your master's here. We would like you to be part of our, the Roux Institute, the Odyssey Center in particular. We'd love you to continue doing your research here. You're welcome to do masters, but we'd love it if you could come up and join us." And that was through some of the efforts of Professor Justin Mangiarides here at Northeastern University, as well as Kristen Kostka, who was the director of the Odyssey Center at the time. And that was kind of how it happened. I saw that I was getting interested in mathematics. I had that opportunity, and I also saw I could keep doing research with their populations up here, and I thought, this sounds fantastic. And so I jumped up here. So now I'm in Boston.
Very well segue to the work on JuliaHealth. But if you allow me one more distraction before that. So you are also a Twitch streamer.
Mm-hmm.
And there you're known as the Cedar Prince, I think. Do I
Cedar
pronounce
Prince?
it? Cedar?
Yeah, the Cedar Prince. Yeah,
the Cedar Prince.
Cedar.
This is a running thing where I mispronounce everyone's name at least in one way. And yeah, I just managed to sneak it in. So how did that start, or what's your motivation behind it, or like what is your experience with doing this?
Yeah, I gotta say, I think Twitch streaming has been a really fantastic sort of, I don't know, benefit in a lot of different ways that I did not expect. So where it got started was, this is spring of 2020. I'm, sent back home, as, many people are across, the world, probably from their institutions, sent back home to wherever home is for them. So I was living in Atlanta at that time. But then I was sent back to my home in rural upstate New York, here in the U.S. And I thought to myself, well, darn it, I miss my friends, I miss the community that I had in Georgia Tech, and I miss the really cool conversations I was having, every day. It was like I could walk out and have some conversation about some cutting edge, maybe like research or technology news that was coming out from wherever, And I thought to myself, like, well, how can I get that? I really want that. And, initially I thought, you know what? I'm just going to make it. And so I decided to start Twitch streaming, both as a way to, meet other really fascinating, cool people, learn from others, as well as, keep myself accountable, because I decided I'm going to start, learning a bit more about Julia, as well as learning a lot more about some of the more applied mathematics. At the time, I was, just going back through some to teach myself Julia. I was just going back through basic linear algebra material just to see how the language worked and everything. Because my first encounter with using the language was back in the winter of 2019. I was testing out the claims of it and everything. And then 2020, I was pretty sold on it, just as a language to use for the future. And yeah, Twitch streaming kind of came about as a result of me wanting to develop that community, learn from others, keep engaging with others, as well as use it as an opportunity to learn more about the Julia language. And so as time went on, it was actually through Twitch that I got to know Ola Kroge, who we worked on. He and I worked on Javis together. And I remember he was basically saying in a Twitch stream, like, hey, we should work on a project together. And I was like, yeah, let's do it. And that's how that started pretty much. And, then that went into like a wonderful adventure there. That's, still kind of ongoing. We don't have as much time for maintenance there, unfortunately, but, we're definitely not archiving it. So it's a great, I think it's a great tool. And the thing that I've enjoyed so much about Twitch is like how it's evolved with me over time. Like, it used to be more of a development stream. These days, I'm kind of doing more of a study with me type of stream where it's much more low key. We study together, learn concepts together. And it's fun when, I'll be working through a proof or something, or just, whatever I'm working on. And, there's a couple mathematicians in the chat and I'll be like, what am I doing wrong here? And they're like, Jacob, you forgot a lemma. And I'm like, damn it. So that's kind of the, that's been the fun with that. So, yeah, to answer your question, it's been such a wonderful experience.
So you're saying that it's about building community more so than just the programming aspect, right?
Yeah,
So you would 1v1 me in StarCraft Brood War as a community event, right?
I mean, I'm all for trying things, man. Let's go. Let's do it.
All right. Because the other thing I would have suggested is Yasuo mid, area, like 1v1, first death loses or something, right? But we could come up with something, right?
All right. The only caveat though is if I play StarCraft with you, you gotta play a couple of rounds of Destiny 2 player versus player with me. That's the only thing.
All right, sure. I'll jump right on. I haven't played those Gen Z things yet, but
it's Destiny 2's not Gen Z. It's like I think it's like Gen X, man.
I haven't done Destiny. I stay away from shooters, but you know what? I'll do it just for the community event. Just for the community event.
We love it.
Looking forward to it.
Well, Michael, you're welcome to join in too. Like, you just have to pick a side, though. I know you want to join my team. We'll crush Chris together. It'll go great.
I was more thinking of whether I would try to do a spectator moderator kind of thing going. Oh no!
All right. You're the okay. We got our announcer. Okay,
we got
we're building
our
out teams. We're building out teams. So anyone in the chat, so of course, comment, subscribe, right? The standard YouTube stuff. But also when you comment about which team you want to be on, which game we should be playing, and I would love to have we just need to build up teams at this point, right? So we're good. And so after we've been playing too much Destiny just to make sure that I can win, we might have chronic health issues, right? So if that was to occur, I hear that you are very into population health and other things like the research and social detriment. Yeah, this is the transition I'm doing. Yes,
yes.
The social detriments of health and health disparities. Can you tell me a bit more about how did you develop that interest in health other than the relationship to streaming too much?
So I think your website states specifically that you're most interested in mental illness as well. So how did that come along, right? So there's a lot of things with health that you could be interested in, but you chosen mental illness. So what's that about?
Yeah, no, it's a great couple questions. So I think maybe the best way to start here is I'll talk about how I kind of got interested in this whole thing in general, because it was really that interest that brought me into like everything that we're talking about today, be it the mathematics, the public health, the Julia programming, that's even the biomedical engineering. That's how it all started. So to give a little story about myself, I'm the son both of a former New York State SWAT team member as well as a undercover detective. That's my dad. He did that for a number of years before I was born. Then he became a police sergeant, worked as a police interim chief for a while. And I learned a lot from him growing up, just around like service, care, and understanding of just everyone's communities. Through him, I've learned so much. I can't speak more highly of my dad. And it was initially through that I first kind of saw like firsthand these situations that people can end up in that really just are these really horrible scenarios, be it themselves as the victim or the one being the victimizer. And so initially I was very interested in kind of these notions from a social level. Then my mother actually is a former psychiatric nurse, and so she was a psychiatric nurse for a number of years. Again, before I was born. Then when I was born, she switched into some other nursing roles, like day surgery, telemedicine, physical therapy, just different sorts of specializations within the nursing field. And she was also just a huge impact on me, especially as it came to health and healthcare in general. Figuring out like what these sort of situations look like, And it was always just an interesting household growing up, seeing kind of this one side, which was, the more justice side, and the other side being the more mercy side. And I always thought, well, is there a way to bridge that? Like, how can we think, collectively, congressively, to remedy some of these, these challenges and these problems? And so as a result, I just kind of grew up in a very interesting sort of environment where these were always kind of things on my mind, as I learned from my parents and things like that. And, so I kind of started feeling like, I want to help. I want to help people. I felt like, I wanted to help as many people as possible. And then, as I grew older and older, especially, when I left, my small valley where I come from in upstate New York, I began to learn more about what's the difference between like rural America versus, urban America, and what, things look like in terms of, access to medicine or access to healthcare resources. And, I started learning about things like social determinants of health, as Chris was mentioning. I started learning about things like notions of disparities and health disparities. And I was like, oh, that's what I've been seeing. That's what that's called. Oh, I didn't know that. Because originally, actually, before I jumped into biomedical engineering, I was actually almost going to go material science engineering, because one of my first initial projects was, and this was in my community college days when I was working on an associate's in engineering science. I led a student team at my community college within the National Science Foundation Community College Innovation Challenge, where we were doing and looking at water filtration and economic development opportunities for different communities, especially like low to middle income communities across the globe. And this research project that we were working on together ended up having us be finalists in this competition for the National Science Foundation. And we went all the way to the United States Capitol Hill to present to scientists, NSF scientists from across the United States, as well as to some policymakers, and I think at least one or two senators, United States senators at the time. And that was actually my first encounter with what is formerly known as public health. I didn't actually know what this notion was of public health until I was almost 19 or 20, even though I've been very curious about what these ideas were. No matter how much I read, I somehow had missed that. I still don't know how. And so that was kind of how I got involved with thinking about health. And when I went to had that experience at the Capitol Hill, it made me think like, oh, there's so much I can do from an engineering material science point of view, but I think there might be a lot more promise to be had in more of this, higher level community health, computational aspect. And that was actually when I started learning programming, because I wasn't a programmer at any point really until I was 19 or 20. So I wasn't one of those, wonder kids, I feel like, who, grew up doing programming their whole lives. I never did any of that. I mostly just read books a lot, when I was younger, or built Legos. That was kind of my two things. So coming into thinking around public health and mental health specifically, I think the mental health aspects were just so interesting to me, just because I saw their direct impacts. I've had a number of friends, as well as people that I've just observed or known, who've struggled with mental health in a variety of different ways, be it ranging anywhere from depression to bipolar disorder, borderline personality disorder. These conditions I felt were extremely, in one sense, this sounds a little strange to say, but I found it very intriguing or interesting just to learn more about what is this, what is this concept of a mental illness. And I also was very interested in the fact of oh, there are proven ways that you can improve one's community to lower that at a net level across a community situation. Because I realized, for me, I felt like I could have a better impact thinking on that community scale than going one-on-one. Because actually, before I went the engineering route, I was very much considering going a more psychology or even theology route for my career. But I ended up going more towards engineering.
So if I understand correctly, then I guess your parents come from a social care and social working back, or one of your parents comes from that background, another comes from psychiatric. There you go to college and you say, okay, I'm going to do some biomedical engineering and make a difference in this world. You go to Capitol Hill, you come back home, and then you just start talking with your parents, and you say, "Hey, mom, have you considered how the cohomology of the universal category of covectors can help improve social care?" And then everyone just doesn't understand you, and so you turn around and say, "You know what? I'm going to make the solution myself," and somehow that becomes JuliaHealth. I guess the transition here is, how did this then lead to something that you now call JuliaHealth, and what exactly is it? Right? Is it
Yeah,
this encapsulation of all these ideas into software? Like, is now you're getting to programming your own solutions, right? What
yeah.
is this solution?
Yeah. So okay. So how did Julia Health happen? That's I think the fun question here. So and even how did Julia happen? So for me, this came about when I finished up my associates at my community college. I went to Georgia Tech and I started working at Emory University's Department of Biomedical Informatics. And there I had the privilege of working with Dr. Gary Clifford, who runs the Department of Biomedical Informatics at Emory University, as well as just being, the creator or founder, I don't know what the term is, of the Oxford Sleep Clinic. He used to be, I think, an associate professor at University of Oxford. And I learned so much from him. And one of the things that I learned, his background was both engineering as well as physics. Something that we talk a lot about was from the biomedical signal processing point of view. He was saying, like, the problem in the future isn't so much that there's going to be so little data, but rather, how do we make sense of the massive amounts of data that we'll be collecting on patients for the foreseeable future? Because, as you know, it's only continuing to skyrocket, both in terms of like ambient sensing, direct interventional sensing,
Hmm.
or testing. All sorts of stuff is happening on patients, and I resonated with that very strongly. I thought, this makes a lot of sense to me. I really agree with that perspective, and so I started looking around for languages. I was exploring things like finding out what could be like Python, but what really could be like C. It was like, honestly, that was really funny. I was exploring things like, what is Clojure? What is LLVM IR? I didn't know what this stuff was, but it's like, this is super performant. But I was like, Common Lisp. I almost was a Common Lisper, actually. I thought that was really compelling, but I was like, man, I don't want to reinvent the wheel for every single piece of software that exists. And then that was when I came across Julia. Like I was mentioning, kind of late 2019 was when I came across it. So this would have been like circa Julia 1.2 ish days or so, 1.3. And I was like, yeah, I think, well, I remember distinctly I programmed like a little small, dumb autonomous agent within Julia. I was using at the time pycall.jl to do some visualizations with matplotlib for this agent. And I got it working, and I was like, wait a second, it's legit. It lives up to the hype. It lives up to the promise. I saw that you could interoperate with different languages. You could get the extreme performance that would be necessary. And I thought to myself, this seems like a language that can solve the problem that, of the separation of the meaningful signal from the noise that comes with all the wash of data that you'll be getting. And that's where I kind of just, hung my hat. And I've done that for the last, I guess 6 years at this point. So I started at Georgia Tech. I started at the CDC. I was doing all my analysis and research work using Julia. And then it was about 2021. I was talking to Dr. I believe now Dr. Dylan Maluthke, who was at the time at the Department of Biomedical Informatics at Brown University. And we were talking about Julia Health. I would do occasional contributions or have occasional discussions with folks at Julia Health. And, I just wasn't sure what was going on there. And then around 2022, I got really interested in it. And I was like, hey, Dylan, can I be more and more active? I want to contribute more and more. I'm making these packages around observational health as well as, population health research. Can I be contributing? And he'd be like, yes, here's permissions. And then it was, I think, either the summer of 2022 or I can't remember exactly when. Dylan's like, do you want to just lead the group now? I don't have time. And he's like, you can see that's been quite quiet for quite some time, because I think it had definitely a peak of activity. JuliaHealth did back in early 2020, when I believe Dylan, as well as others at the Department of Biomedical Informatics at Brown University, had set up JuliaHealth. But then by that time, I'd largely tapered off to being almost non-active. And I was like, You know what? Sure. I'd be really interested in like leading this group, and seeing what we can do here. And so it's been like this fun story of, you know, for me thinking around like, handling all these sort of research questions, handling all this data coming in, thinking through like how can we enable the future of high performance computing in especially like healthcare, population health type research. And not only like this sort of, modeling perspectives, but also some of the, I guess you'd call it like more like our type of work, like a lot of the social sciences, like health economics research, or, these sort of other social dynamics work going on, like working with census microdata or survey microdata and things like that. And now it's just beautiful to see how the ecosystem of JuliaHealth has been evolving. And I'm happy to share more about that. But that's maybe kind of how we finally get now to JuliaHealth and where that comes into the mix of everything.
Share about that. I mean, because I mean, I think one of the things that Michael's noticed and one of the things I've noticed is that there's a whole lot of packages in there, and they're fairly technical names, right? It's not like you can't really just look at it and go, oh, I know okay, this is about differential equations. Some of those names in there are like,
you're like,
is that a file format? So what exactly all is in there? Like, could you kind of give us the sprint through, what you have in that this whole organization?
Yeah, absolutely. So it's still kind of coalescing. We've kind of had an organic growth, honestly, a bit of an explosive growth, I'd say, in the last 2 years. As we know, we've been kind of building more and more of the community. I think we went from originally like 130 members or so in our little like Slack channel there to now almost like 300 members. So it's like really exciting to see it, growing. And as a result of that, there's been certain, like we refer to them as like sub ecosystems within JuliaHealth, just kind of naturally emerging and organically growing. So there's no like any, high level sort of like directive of like, we must focus on medical imaging, go forth. It's not like that. It's really people coming passionate about various aspects of the healthcare, patient healthcare continuum, and just building something really cool about that. And so, some particular sub-ecosystems that I'll highlight that I think are getting more and more mature is, for example, we have the medical imaging ecosystem, which is really focused around, anywhere from, the package Coma MRI, which is, created and supported by Dr. Carlos Castillo-Passi and his group, I believe at Stanford University, as well as some of his colleagues back in Chile. We also have some work being done on what's called like the MedPipe ecosystem, which is related again to medical imaging, but more, I think, on CT scans. And this is spearheaded really by Dr. Jacob Zelko, who is based out of the National Information Processing Institute over in Poland, as well as some of his students across both Poland and Germany. So, that's just one, area of medical imaging research being done. And again, there's so much you can delve into with medical imaging. Like, I'm not someone who's an expert in medical imaging. So I've been learning so much from these folks as I see them building new things, registering new packages, developing new packages, and talking about things. It's been really exciting. And then, further on from there, we also have the observational health ecosystem. This is kind of more my bread and butter when it comes to population health research. So we have things related to medical standards for what's called like the observational medical outcomes partnership common data model. But we refer to that as the OMOP CDM just for short, because no one wants to say that whole term. But in the observational health ecosystem, we've been developing a lot of tools centered around this particular standard for doing things ranging from, just descriptive statistics to doing defining population cohorts, as well as like target and outcome cohorts. And now we're even veering into more streamlined processes for doing like end-to-end observational studies in Julia for like, population health or not population health, patient level prediction sort of problems or precision medicine problems. And it's really exciting to see how it's been emerging over the past, I'd say, two-ish years with that. But then we also have some other like ongoing work with like geospatial health informatics. This is looking at using like tools from like the Julia Geo ecosystem and thinking like, okay, can we interoperate with, survey microdata that exists across not only the United States, but across the globe, and maybe do mappings around like social factors that can impact health, such as like education levels, or other sorts of maybe at-risk behavior that we'd be curious about mapping, both in the United States as well as globally. And then we also do have some other small parts of the ecosystems that are growing. Like we have one dedicated for innovation. We have another for standards and interoperability, and also just some like kind of bespoke like packages that don't quite have like a home yet in terms of an ecosystem. But they're here for you to work with. Like we have things for DICOM imaging. We have things for additional sort of utilities for working with like a voxel sort of approaches in medical imaging context. So things continue to grow and develop, and it's quite exciting. And now that we're finally reaching this level of maturity, we're starting to kind of put pen to paper finally of like these entry points. Because as you mentioned, Chris, like you go to maybe JuliaHealth GitHub and you look at the packages and you're like, what are these?
ICD underscore gems. I know exactly what that is. Yeah.
General equivalence models. We talk about those all the time.
Yeah, but I think that once you give so there's a lot of things here related to imaging, a lot of things here related to different survey data types and other data types that you encounter in the observational data space. Okay, that starts to make sense. I might not know what some of those data formats are, but I get a feel for now what all is in there.
Yeah.
Also, so with some other utilities like and then there's a PubMed miner, right? Which I guess that kind of goes along with it. Because PubMed is used for both. I mean, I know more from the biological spaces where I'd search for different proteins and such. So I guess in the observational, I mean, it's searching all biomedical research articles. So you probably are grabbing other information from there, but I can see how it's useful to different communities, and that's still something you say. You know what? Let's go and maintain this in JuliaHealth.
Yeah. And I would say like maybe like just for a point of clarification, maybe just for anyone listening too, is there's BioJulia and JuliaHealth. And I think when like maybe some of the distinguishing parts here, and this is where it gets a little tricky, is that although we do focus on things like pharmacovigilance or things like medical outcomes and things like that, I would say that JuliaHealth maybe is like a higher level, some way operates on a higher level where generally our population counts might be closer to like, any, like as a minimum, like n equals 10 people or so for your cohorts, at least at a minimum, and ranging anywhere upwards. Like, I'm doing a study right now that involves like 35 million patients. So, we scale up quite hugely with our populations. And I know that BioJulia, they're honestly our friends, like they're kind of our neighbors, and we love to like give like support to as many organizations that we work with as possible. And BioJulia, I think, really focuses on like, things like omics research, as well as, kind of like gene sequencing, this sort of lower level sort of things. There's like I said, it's a little bit of a fuzzy boundary here, but I'd say like if you want an arbitrary threshold of maybe where we might be different from the two, is that the moment we start going into like larger populations versus like small populations, or even just looking at like one particular, maybe molecular pathway, or, pathway that, triggers some sort of like, protein or some sort of cascade event. And, I'm thinking like the HPA axis, like hypothalamus pituitary adrenal axis for stress responses. If you want to start studying that sort of material extremely closely, you might want to start looking into BioJulia versus maybe JuliaHealth.
Yeah. Okay. So I mean, at a high level, like if you're going to do like these large RNA-seq experiments because you're going to cut off, 100 million arms, right? Then you're like, okay, you're probably going to do that on rats. If you were to cut off 100 million arms of humans, then you're likely a sociopath, and we don't want you with JuliaHealth, right?
Yeah. You might want to. Yeah. Good operation, anything, but different context.
Yeah, you can get tons and tons of zebrafish embryos, but yes, if you're getting a bunch of human embryos, there's probably an issue here. I got you.
Yeah. It's a fuzzy. I do concede it's a very fuzzy boundary, but there's a type of boundary there, and I want to try to express that.
I mean, the interesting association that I currently got in mind is maybe. Hopefully many of our viewers and listeners are familiar with the XKCD comic, and there's one in particular that sorts sciences according to a level of abstraction and detail, and in some sense you're covering currently both ends of the spectrum, right? So JuliaHealth is more like sociology because there's so many people, and it's a population-based analysis. And then there's BioJulia, and then eventually we would come to like quantum chemistry and physics. And then on the other end is applied math, and you're like, yeah, I'm here also as well. Like,
well,
yeah,
and then,
just for me personally, but what were you say, Chris?
Well, I was gonna say, like, on that spectrum, there's math over here, right? We're like, hey guys, we're over here, but then like we're actually pushing a group to this very side, and the ones pushed to the very end, that's the category theorists, right? So...
Oh, and you forget that the category theorists are even pushing out the epistemic philosophers out of the picture completely. Like they're just not in the picture at all. So,
but somehow you are in a superposition between the category theorists and the public health folks. All right.
Yeah. So very abstract to very practical.
But I mean, when you list off all that, none of the applied category theory things are in JuliaHealth. So do you consider that part of the research completely different, or is this something that is like a down the line? You know, you're like, oh, you've just been getting the category theory stuff going, and sooner or later it will be part of JuliaHealth.
Yeah, I'm really glad you asked the question, just because it's something that's been honestly on my mind really since I started seeing what I thought was the potential for kind of these things to converge at some point. So like, even though they converged in myself personally, as someone studying these topics, they haven't, as you've noticed, haven't like observed like converged in like a meaningful way in the application sphere just yet, or at least in the public sphere just yet. So that's why, maybe to give a reason for that or rationale is, yeah, I do see it as kind of something that's still kind of incubating a little bit. But I'm actually finally going a bit more, public with some of the ideas, as well as some of my collaborators and I are talking more about, where can be the actual meaningful applications here. So just the earlier this year, for the first time ever, I was presenting some of the work at the City University of New York's Graduate Center's applied category, or not applied category theory, their category theory seminar, where I presented some of these ideas publicly for the first time. Seemed to be received quite well. Kind of inspired by that, as well as motivated by that, myself and collaborators submitted some of our work to ACT 2025, which will be this year. It's the International Conference on Applied Category Theory, and it'll be at Gainesville, Florida this year. So I'll be down in Gainesville presenting some of the work there.
James Fairbanks Group running that? I mean, that's a very specific place to choose, right?
Yeah, no, James is one of the lead organizers. So he was
yep.
Come on down. We got University of Florida. Come on over. So that'll be, I'm excited for that. And then actually some of the work as well is going to be presented at the Transactions and Category Theory Conference in Glasgow, Scotland, later this summer. I won't be there, but one of my collaborators will be presenting.
There seems to be a very specific trend here that I'm catching, that you are doing a lot of the things to discuss applied category theory to category theorists and applied category theory groups. Have you tried taking category theory to the public health conferences and some of the people who are just working with EHR data itself? I mean, because you must know you know the people at the other side, right? So
yeah,
it's kind of curious that you now listed off a bunch of these conferences specifically in category theory, right? Have you tried to bring it to the other direction yet, or do you think that translation's maybe not ready?
No, so I'm actually really excited about that. So we're finally doing that, or starting to do that right now. So the two ways that we're doing that is myself and a couple of collaborators are hopefully organizing a workshop this fall at the Banff International Research Station in collaboration, I believe, with PIMS. And I think I can't remember, they're in the Mathematical Research Institute that is focused over in the Pacific Northwest of the United States. And together, we're like right now drafting material for a workshop that will bring together both like mathematicians, both peer and applied, as well as bring in public health personnel, as well as specialists. And something that I've failed to mention, but is very crucial here, is actually I work directly with like almost every week the University of Saskatchewan's Center for Computational Epidemiology and Public Health Informatics Lab. They go by CPHIL. And this is actually a consortium of both computational scientists, as well as trained epidemiologists, as well as public health personnel. And so even though it's not publicly, like, we're going to bringing these materials just yet to the public yet, we are directly working with these folks in epidemiology and public health circles, to the point where, like, CFO specifically has been involved with, some of the various, ongoing outbreaks of pertussis and other sorts of epidemics, epidemics, localized epidemics in parts of Canada. So these are being tested out in practice or in like actual real world scenarios, but it's not like we've necessarily gone fully public with that just yet. But this year, I'm hoping to be changing a lot of that. So as I mentioned, we've kind of been incubating, but I think we're finally getting to that point now where I feel comfortable going public with some of these ideas, as well as I think, as you pointed out, I've been showing a lot of these ideas more to the category theorists or more the applied mathematics community to make sure the ideas hold weight and hold, like, they seem like the analogies make sense. Now it's, coming back into that bridging perspective. And the ideal world, and this is something that I'm the most, passionate about right now, is myself and my collaborator and friend and mentor, Professor Nathaniel Osgood. We've kind of identified what we call this field being compositional public health, is this notion of the intersection of public health methods with systems engineering, with category theoretic methods, and thinking around, like, how can we kind of merge these ideas together in domains that are, relevant and prescient for the public health research community. And currently right now we're, working on developing what we call compositional public health as just a new emerging applied research field of its own nature. So that's kind of where it's at. It's still, like I said, incubating, but we're not at the point of actually, like, we think we have something here.
I'll be happy to see that transition. I mean, because I do know I have seen you asking questions about differential equations and stuff, so I do know that there has been this like epidemiology thing going on and such,
Yeah.
and so I'm looking to see when all this kind of comes into JuliaHealth. It seems to be a little bit in stealth mode right now, but I guess you're looking to get it well actually by a few mathematicians before going fully public with it. It sounds right. So.
Yeah, and maybe just one quick comment too that I'll say. You said this one thing that made me think. So JuliaHealth is also a pretty interesting kind of like open source org, I think, within the Julia community, because, and maybe we can chat more about this at some point today, but one of the biggest problems that we encounter within JuliaHealth is that not only are we research, like, we develop research software, figuring out how to handle standards, but a problem that we tend to run into is that we love kind of also, as a lot of us are researchers as well, using the tools to actually drive research together, like research studies or research sort of approaches. And so it's an interesting problem where sometimes we don't really need to build any software. So, I'll have students or, potential collaborators or volunteers wanting to reach out to JuliaHealth saying, like, point me to an issue. I want to work on some stuff within JuliaHealth. And we do have some issues, but sometimes what would be the most meaningful contributions for us is also enumerating some of these workflows to show, like, hey, just because Julia is so strongly compositional, it's not that we actually need to reinvent new software. No, just go out to SciML, use your differential equations library, or in my case, I love using Modeling Toolkit. Grab Modeling Toolkit off the shelf, and then show how you can use these tools for like this specific public health problem. And that's sometimes like our biggest need for contributions, honestly, is both showing these workflows and then showing how they're actually used in practice. Like myself, I'm happy to like mentor and supervise. I do a lot of that. I love mentoring. I have a number of mentees right now. We're working on a variety of different problems and projects. But yeah, a lot of times our biggest problem isn't so much we need to reinvent a new piece of software. It's that we just need to show that you can do this in Julia and it's fully possible.
So here I thought you would be leading like you would be segueing into a completely different aspect. Which brings me to the next question.
Yeah.
We always ask the guests, is there something that you want to talk about? And you had a very clear answer. And you said we need more tools to interface with various data sets.
Mm-hmm.
So can you expand on this, please?
Yeah. So it's and this is where I was kind of just like mentioning a little bit, is like the problem isn't so much that we need to like keep reimplementing these new, machine learning approaches or what have you. I think R, especially if folks are coming from R, is perhaps a little notorious for this because of the way R is constructed. I share a lot of the same sentiments. I know you had Dr. Karandeep Singh on recently on the podcast. I share a lot of the same sentiments and thoughts as he does around the R ecosystem. I think it's great. I think it's really powerful in a lot of different ways. But what's funny about Julia is that because, we're JuliaHealth, with the composition, we don't need to like reinvent, your favorite machine learning algorithms or your favorite differential equation modeling packages or, systems. Instead, we can really just compose these things together. And so really what we need, and it's the less glamorous, and I understand it's the less glamorous part of research science, especially in public health or population health, is we just need support to bringing in these sort of tools as well, not tools, but rather data sets or access to data in a winsome, usable, workable way within the Julia ecosystem. To maybe give an example of this is there is a fantastic data resource, and they have an API for it called iPums. iPums is just a name at this point. Even the creators of iPums say it used to have a name, something microdata services, but it means nothing now. We're just iPums. And I was like, okay, great. But iPums provides a lot of extremely valuable information on a variety of different relevant data sources related to healthcare across not only the United States, but also internationally, ranging anywhere from sociodemographic information and like things like employment, things like how many children are housed in your home, how many people are applying for food stamps or unemployment benefits, things like that, as well as things like chronic disease indicators, like rates of substance abuse in a community or things like that. And this data resource is such a great tool and resource. And for example, in Python and R, there's various packages that exist for interfacing with iPums specifically. And there wasn't something that existed in Julia yet. And it's always a tricky problem, I found, is that, within Julia, we do have the promise of language interoperability. We have Python call for Python. We have R call for R. We have this strong ability here. And I have used, prolifically some of these tools, especially like early on in my Julia use back in like, I'd say this was like the 1.2, 1.3 days. I would use PyCall all the time to use matplotlib because I didn't find like a good, for myself, I wasn't comfortable using plots, or I couldn't get Maki to work at the time. Nowadays, don't worry, I use Maki all the time. We're at the Maki train now. But one thing that I've encountered is when I teach people how to use Julia, be it my mentees or give workshops, as I've given a couple workshops, is that the language interoperability does look really cool. A lot of times I found it can be really hard for especially beginner Julians to meaningfully bring it into their workflow unless if they are extremely savvy with, be it, working with your command line, your shell, your sort of like export variables, your pathing. If you don't have an understanding of that, it can be really challenging, I found, for folks to tap into that part of the ecosystem. And so one thing that we decided to do last summer as a Google Summer of Code project was to kind of kick off thinking around like how could we make an ipums.jl package. So that way we have like a common interface within the JuliaHealth and Julia ecosystem more broadly to do work with this fantastic data resource. And again, like I said, it's not really a glamorous part of the Julia ecosystem. It's not like implementing a new model. It's not, doing a machine learning algorithm to get you a really cool statistic at the end. And I love those, don't get me wrong. But what I love even more is to be able to bring into the ecosystem those opportunities for people to be using these resources to do these sort of neat workflows. That's why I was saying like earlier, one of our big problems is workflows, is thinking around these problems, and yeah, so that's just some thoughts there.
I mean that really seems, that's kind of open source in a nutshell, right? Like everyone
Yeah.
kind of goes, "Oh, what is the cool new mathematical problem I can solve if I work on open source? What is the most necessary mathematical problem to solve in open source today?" And I think if you ask most maintainers, are like, "Oh, we got to support this file format. Oh, there's this new database that came out. We got to support this." People are getting mad that we don't have support for this yet, right? And so it's just like, there's this core thing of just like unlocking hundreds of thousands of scientists. Half the time it is, we need to support this new format. so you are fighting the good fight right there with good sir. I mean, definitely that is one of the main things that always tends to happen, come up over and over and over.
But maybe we can try to incentivize young people, especially early career researchers, in that if you find time, if you find yourself with a little bit of time and you want to positively impact your research career, and you create this package that just interfaces one of those lesser supported data formats, and then you tell in the GitHub, please cite, and then give a specific paper, your citation count can go up so quickly, just because a lot of people will, as you pointed out, it's so easy to compose these things. They will use it, they will cite it, and your citation count will go through the roof. If you're the first to unlock a vast data trove.
Yeah, and I'll mention, so it's like, if you're creating teaching materials, if you're creating like a guide, or if you're creating, an example to show your like a model that you're developing or something, like, people in our ecosystem, they use like the datasets package that I believe just has like things like the MT cars dataset, the iris dataset. It just has all these datasets in there. And then Julia, I forget who did it, but we created like a translation of that, which was called rdatasets.jl. And so you can just pull that into your into your, favorite setup that you have for working with Julia data science or modeling workflows. And as a result of that, people just take that for granted, that you can just pull in these data ecosystems and just start working with analysis and showing, like, here's like an example of using this model or this new approach that I talked about. But exactly, Michael, you're exactly right, because people will just kind of either take that for granted, or they'll just import that in and then just, cite it. There it is. People are using it. And so it's a very, like I said, it's not a glamorous part of the science here, but it's the part that makes science work. And for me, I'm willing to do that. I want to see my mentees and potential future collaborators and contributors just using this stuff. I see myself more as, sure, I'm the leader of the JuliaHealth ecosystem, as well as some other roles in the Julia community. I see myself as kind of more of a, in a sense, like a plumber a little bit, where I'm like happy to make sure that the things that keep the rest going, it can happen. And I'm not as prolific as, I think one person that I love and I take a lot of inspiration from is actually Dylan Maluthgay, who I mentioned earlier. It's very common, at least early on when I was learning Julia, this was like circa 2020, 2021, around that time. I just see Dylan just kind of randomly pop up on, be it Julia issues, talking about CI problems or other problems, and Dylan just knew how to fix it to get people unblocked. And Bob's your uncle, you could get this issue finalized, merged, whatever you need to get done. And I love that. And for myself personally, although I do have my own research interests, like as we talked about, like the applied category theory, the population health modeling, all this stuff, I want to see the next generation of Julians, and honestly, just be it researchers or even hobbyists, have the means to be able to meaningfully investigate the questions that I do.
Taking it one step further, coming back to the very specific call to action with respect to the data availability, you also mentioned that this has some urgency to it, as there's a currently an effort going on that's called the Data Rescue Project. Can you share some background on this as well?
Yeah, absolutely. So the Data Rescue Project, and just to be clear, there's a variety of different sort of ongoing sort of like conservative efforts or conservatory efforts around preserving various data assets across the globe. And as you know, we go through different times just as society, a lot of different data assets can either be interrupted, they can be taken down, they might not be backed up someplace, or they might be backed up but just hard to access. For example, archive.org, or the you might also know it as the Wayback Machine, does a wonderful job backing up various data sources and websites and information across the globe. But it is notoriously hard to actually pull information out of there in a programmatic way. And as a result of that, it can sometimes impede, especially like scientific workflows, something that, I think a lot about. And I think, a lot of folks, both within JuliaHealth as well as, just in the greater ecosystem and community, think a lot about is for scientists, we want to make sure as a community, we can enable scientists to do their scientific research and work with as little interruption as possible. And so, to think around the Data Rescue Project, there's others like called, I forget who runs this operation, but it's like SciOp, science operations, where they also backing up various data assets. There's also like Harvard Dataverse, something that is a very like low hanging fruit, but also could be really exceptionally useful for a variety of researchers, in the broader Julia ecosystem, is developing tools to interface with these sort of archival locations. So that way, if there's an interruption, you can very easily just, go use this package and pull it back up very quickly and just continue on with your workflow. And again, like, it's not a very, cool thing, because when it works great. You can just keep doing your work. But again, it gets back to that problem of, I'm someone who wants to make sure that we can just keep things running as smoothly as possible. And if someone wants to be involved, I say not only in the JuliaHealth community, but just in the broader Julia community, like, even if you don't know any sort of, mathematics, or you aren't so familiar with Julia just yet, honestly, like, building or working with APIs that a lot of these places do provide and support can be a great entry point to honestly help us like make sure that there's as few interruptions as possible for researchers. So yeah, to specifically talk around like the Data Rescue Project and some of these other projects, that's something I've been thinking a lot lately, especially, I'll give one example where we had an interruption around some United States census data that we were working with. And, we had the service go down, just, I think it was something with one of the certificates expiring. And, there's kind of this, moment of, oh no, what should we be doing here? But then, myself and some folks in the Julia community just kind of put together our heads thinking around like, okay, how can we get back to using this data that we need for census, analysis? And we were able to like create a quick little web scraper to do some scraping on like the Wayback Machine to get us back and working. But again, it's nothing that was a package yet, but it could be something that could be turned into a really great project in the future. And so yeah, that's maybe my thought there.
Yeah, so it's like, if someone was to like, let's say randomly cut the budget of the NIH, the National Institutes of Health, by like 50% or something, your data rescue project would be the kind of thing that would to make sure that, if some doji kind of thing just kind of ran right through and just got rid of all these data sets would still be alive, and you would have tools to be able to use them within public health settings. Are you hosting these online, Samar, or are they all being kind of just captured in a local archive just in case for the future then that you would put up if these things actually end up going down?
Yeah, so I know for a fact, like, Harvard Dataverse, the Data Rescue Project is not, I don't believe they're one. I think they're more of kind of like an aggregator, sort of saying like, here's where you can look for the data sources. But I know Harvard Dataverse, SciOp, There's a couple others that say like, hey, if you do want to contribute your backups, here, they have like onboarding and contributing guides to say like, here's how you can contribute your data asset or your backed up data version to us. I know also archive.org, it's as simple as going to like, here's my URL. I go to the Wayback Machine, I paste in my URL, and I say create snapshot. It'll create an entire snapshot of that website for you at that place and time. It might just take like 15 to 20 minutes, depending on how big of a backup you need there. But yeah, so that's kind of, what we're like, some of the approaches that we take, as well as looking at like how we can, publicly, give back.
We've now talked for 1.5 hours, and I don't know about your plans. Like, this is the last point of my schedule, but do you have somewhere else to be at any new point in the future?
You mean like life or like after the
No, I mean,
well,
like,
we know you have no
I
life.
need to wrap things up quickly because people are busy.
Okay. Yeah. You mean, wait, hold on, I'm still confused. So we mean like in the podcast, or we mean in the like?
No, I mean, like,
myself.
So, like, I will get tired in about an hour or so.
Mm-hmm.
But I could continue to talk for an hour. But I'm like typically looking at Chris in particular. He always has a very busy schedule.
Mm-hmm.
I left open the whole afternoon for this one, so because I knew that this one would go. So
All right.
so I mean, but I do think that as a meta comment, I don't know how much of this meta comment we're leaving into the episode.
Yeah.
But as a meta comment, I think that we spent a lot more time going into introduction stuff than we normally do here. So I think normally we aim for an hour episode, and we're well past an hour already.
Yeah.
We still have bullet points to go on.
Oh man. Well, I'm good for like maybe another half hour or so. I scheduled out until like 4, so I'm good.
Yeah, I mean, so the next bullet point on our talking point list is the commentary on the politicalization of health.
Yeah.
And I mean, if you want to, we can definitely dive into this.
Mm-hmm.
What was it? A yes, I want to, or is that a?
Or are you scared of being deported?
No. I'll say, like, since we're just kind of like stepping out for a second, kind of my statement on that would just be like, what we were saying earlier, which is, the JuliaHealth organization, we're an international group, and we're just focused on like how can we, provide, support to everyone with as little interruptions as possible. That's our number one priority.
Mm-hmm.
And like, and that those interruptions can be anything. So I guess that's kind of where I'd leave it, just in terms of like the political statement here, just because that's where we think about with Julia.
I mean, that sounds like a short thing to include, so we just need to go back from meta discussion to discussion.
Sure, you can pose the question, and I can give you my little short statement here.
Yeah, and so I mean, you mentioned the efforts around the data rescue and data formats. With currently, as Chris already mentioned, we're recording this in May 2025, and public health approaches worldwide seem to go into different directions. Is there anything that unites, let's say, the JuliaHealth approach, or like what should other people be aware of things that might be going on? Or
no, it's a great question, and just kind of as leader of JuliaHealth here, our goal has been, how do we both enable, empower, and support, be it researchers, be it people interested in health, like public health or health research in general, to answer their questions, do investigations, do research with as little interruptions as possible. And this can be ranging anywhere from data just going out due to certificates expiring, to anything as complicated as political or sort of social situations happening across the globe. And as always, we will be like working to support our international community in as many ways as we can. So that's kind of my thought, our thoughts on the matter for the moment. Hope that answered the question.
Well, I mean, I want to make this a bit more concrete, right?
Yeah.
Would you call yourself a Julia artist in a data ambulance?
A Julia artist in a data ambulance. I do like this metaphor, actually. I would say,
Well, because
yeah, I
there's a
think it's a good.
segment
I
that we
think
got.
it's actually a quite good analogy there. I actually quite like that. Just because, yeah, it's like, you know, maybe for context, I'll say the context. I'll say the context. So, like, for folks here who love punk music and love like your early 2000s, emo rock sort of stuff, go check out Artist in the Ambulance by Thrice. Come back, like, listen to it, and then come back to this part here, because what Chris is asking is great, I think. So what Chris is saying, are you the Julia artist in the data ambulance? And I actually quite love this idea because, like, I'm gonna take this, Chris. I'm gonna run with this for a second.
All right, run with
Actually,
it, run with it, and
I'm gonna run.
we're
Here we
doing the
go. Here we
karaoke
go.
section
So
after this. Yeah.
I would say, yeah, I really agree. I would say yes, actually. And if you go back to that wonderful song, the artist in the ambulance, the artist is the one, who had that, sudden trauma, that sudden, thing happen to them that put them into the ambulance, needed to be, taken away and, like, taken care of. Basically it put them in this very vulnerable situation to figure out, like, how can I, deal with the reality of the situation as hard as possible. And I think, going back to our initial discussions around, like, be it pandemics, be it, growing up, be it, whatever, yeah, Julia has kind of been the tool for me as, sort of the guiding paintbrush of, the strokes to the solutions that I try to make here. And, to go with this analogy further, the data ambulance, as you were saying, I feel like that's like the kind of, you get hit by it in a sense of, like, you have this, the stranger taking care of the person in the ambulance. Like, why would someone go out of their way to emphatically just go help someone who has gotten injured at risk to their own selves? And I think it's really a fun thing to think about here, where there's kind of this sort of interfacing that happens where we are in a situation that needs, we have a solution, we have a means or a paintbrush of which we can use to, like, paint, a solution or, any depiction that we want. But then, we encounter this, situation or story that's brought to us kind of like out of the blue in our own lives. In this case, the ambulance kind of responding to our, our desire to create. And in this way, I would say that, I feel like the data in this case, like, the data ambulance is like our interface to say, like, here's the story I want to tell, and here's the, reality that I get met with, which is someone is taking care of me and showing me, this story of their own. And, sure, like, in the artist in the ambulance story, you have the person who's the artist getting, in this trauma, in this event, needing to be rescued by this ambulance driver, and you have this wonderful perspective of the artist saying, like, I have, like, I can tell this wonderful story, I can tell this wonderful thing. And then you have the ambulance, driver, and the ambulance, like, responder, saying, like, is all I'm doing, is all the story, is all the information that I can share, is this really meaningful, is this actually going to make an impact? And I think for me, like, that's something, riffing on this analogy, I think that's something that I want to try to do, is as I'm confronted with information, as I'm being told this information, it's like I want to create a meaningful story and a meaningful piece of, like, a masterpiece out of it that can ultimately, like, both guide, inspire, and perhaps even help, people in the future. So I would say yes, Chris, to your fun little question there.
I feel like we, just for everyone to truly understand, we do need to give a little bit more background, right? I feel like they need to know some of the lyrics of the song that we are referring to.
Uh-huh.
So let's start from the third verse, just a little bit, right?
Oh man, I don't have it unlocked though. I don't have it on memory, man.
Oh,
I know the vibe. I'm sorry. Are you gonna? Do you have it?
Well,
Do you have
well,
it?
you're doing this too. You agreed when we were putting this together. You agreed that you were going to sing this with me, right? So, late
Oh
night brakes
man.
lock, hear the tires squeal. Red light can't stop, so I spin the wheel. My world goes black before I feel the angels steal me from the greedy jaws of death and chance. Pull me in with steady hands. They're giving me a second chance. The artist in the ambulance, I hope that
That
I
I will
will
never
never
let
let
you
you
down.
down. All right, there we go.
Yes.
And
But
didn't
I just
someone
love
wanted
that
to put
though,
the
right?
guitar when we because the lead guitar on that is also pretty
Oh
like
yeah,
epic.
yeah.
Oh yeah, but I mean, I just love that idea though,
Mhm.
right? Like, you have this life-changing experience, and you just think to yourself, like, you know, with that like showing of like really like mercy or grace in that moment, like by some like stranger just coming up to you and being like, "I'm gonna save your life," you're like, that just completely just transforms your mind, and I just think that's just so beautiful. And it's like when we encounter these situations, I think like both like and just in general, but maybe like specifically from like the health point of view, like since that's what brought me here. When I think about that from like the health point of view, for myself, I've gone, growing up, myself, I encountered many times like going to the hospital and having to be, taken care of. I grew up, unfortunately, with, a couple chronic illnesses. And for me, it was always just like, getting taken care of. Like, sure, it is their job, it is their profession, but at the end of the day, it's how they meet you to care for you. It's how like they can actually like be a doctor or clinician, really see you and understand you. I'll never forget like my childhood doctor. His name was Dr. Herschel Leister, and I was all I go to him almost, unfortunately, like on a weekly or bi-weekly basis. I was going through quite a lot, and he would always be the one to brighten my days, no matter how sick or under the weather I was feeling. And it's people like that that can just really inspire and motivate you. And I think coming back to this discussion here today, it's like being someone in the community who can just unblock and enable as much as possible for people is, so to me, a very, very important very important thing. And it's something I try to like live up to. As we say, like I'll never let you like I hope that one day I can never let you down, or I won't let you down. I think that's a beautiful adage.
Yeah, I feel like before I didn't truly understand, like, you said, like, oh, because I think I got this piece of information a few weeks ago. It's just like, I don't understand quite why, why would when I say name a band, you go Thrice, right? I remember the song for like 20 years ago, but now I kind of like, I feel like I got a whole picture of you. I feel like I got a whole picture of you, like, oh, you grew up with a family that like was trying to solve these health issues, and you thought that you can, you went to college and you realized that, oh, I can come up with a fully different way. And so I always saw like, oh, you do some things with Julia, and you also have a bit of this JuliaHealth stuff. I don't see how it all comes together, but now I kind of see like this more rounded version of Jacob, of like you have you're pulling together all these new resources and these new tools that you've been of the modern century, and you're asking this question, like, what are the new tools that no one has considered yet? Applied category theory, streaming, and all these and other modes of intervention with the population. And how do I bring this to solve health problems that the way that I've been inspired by my father? Like that is like a very beautiful story, I gotta say.
No.
And
Well, thanks. Yeah.
and one final question, I think, would be remembering to say, I hope that I will never let you down. Now that you will graduate in the very near future, and I mean the research, the way you described, okay, I'm gonna first take care that the math gets completely checked by the peers, and then we're gonna go to the health researchers. But what about the streaming? Will you do more
Yeah.
streaming sessions in the near future?
Yeah, my hope is definitely to come back to this. I want to like I'm going to be going on vacation actually next week,
Yes.
so I'm very excited about that. I'm quite tired. It's been quite a busy last couple of years, I gotta say. So I'm gonna go on vacation for a little bit.
Where
But then
to?
after that, I'd love to get back into streaming, especially because I've had a couple of people asking me to get back to it because they loved it, and I mean, I personally loved it too. Because like the thing that I just never thought to consider, or maybe I just considered it, but maybe not enough as I should have, is that I didn't realize how much I was going to learn from people while streaming. I'll never forget. Like, I think one of my favorite moments while streaming was we had someone come in who was, I think they had, they were former United States military. They were trying to like kind of break into the world of technology a little bit, and the fellow was asking some questions. They come into the stream, ask some questions, and at one point, this fellow said, like, "Hey, I really, really appreciate all the time that you've taken, like, in your streams during your breaks to like answer my questions. You may have just changed my life, and I really value that." And I thought that was just a beautiful story. And I've also had like other people who have said things like, "Yeah, I've never considered that, and for me, that's something uh, that I'll now carry going forward." And I think that's just such a beautiful thing. I never realized like one, like the impact I could be having, but also like in the same way, like how much impact they could be having back on me by sharing these things. So
I mean, that's Newton's
yes.
third law. Yeah.
Yeah, exactly. Every option, yeah, like action has an opposite and equal reaction. So yes, the hope is to be getting back to that hopefully sometime this summer. I do have a couple of conference plans. I'll be going to like international
Bunch of
kind
category
of
theory conferences. Yeah.
that one, and then there's a little special one also in July. It's like something about a weird language. I think it's called like Julia or something. What was it? JuliaCon? Is that the one we're going to in
Oh
July?
yeah. Yeah.
So
That's JuliaCon is in July. I think it's July 21st to
Yeah.
27th. Everyone who's listening to this podcast should definitely go. We'll have special sessions where we will give every one of you a hug, only if you want, right?
yes, and we will be hosting the first ever JuliaHealth mini symposium at JuliaCon
Woo!
2025. So if you're interested in anything that we were talking about today and want to chat, a number of JuliaHealth people will hopefully be there this summer. So we'd love to see you.
And
Yeah.
just thinking about your larger plans too. I mean, if you're graduating, are you building your own lab soon? Are you going to PhD, or are you industry, academia, or are you sitting undecided right now?
Chris, it's a really good question, and it's something that I've thought a lot about. And I'm also a little bit more sentimental because actually, I mentioned this the other day. Today's actually my birthday as well, so it's like get me facing my mortality a little bit more than normal, I suppose. And yeah, in terms of future plans, I would love to go on to doing future research. I'm considering kind of the various options for myself personally, like for PhD work, in the next cycle. In terms of like what I'm doing right now, I'm going to continue doing JuliaHealth. I'm continuing helping with leading or co-administrating Google Summer of Code within the Julia community. So it's wonderful to see like some mentoring happening. I might be helping with some of the mentoring. We'll see how that shakes out. But regardless, I'll be working on a variety of different research projects and tasks here. Some related to I'm wrapping up a study right now with some collaborators in Poland on cardio oncology research. I'm doing some research in what's called deaths of despair, which is related to some of the dynamics in play in the United States socioeconomic landscape and healthcare landscape. And yeah, so I think that'll be some of what I'll be doing for next year. But also, I'm excited to just take a little bit of some time and have some fun living. I think
Yes.
one thing that I love doing is I love going dancing. So I do quite a lot of like Latin dancing, which is fun. I have a lot of friends that I do that with. I'm also thinking since it's beautiful here in Boston, I'll probably I'm gonna pull the trigger, I think, and get myself a sailing membership to learn how to sail. I did a little bit of sailing when I was a kid, but the river beckons. I gotta get on it. I gotta see like how much better I can get. And I think beyond that, we'll just see kind of where life takes us a little bit for this next year.
Alrighty. I think
Sounds
that's all
awesome.
the questions I had. Michael, did you have
Yeah,
anything else?
I am very honored and glad, and just very grateful that you dedicated so much time, especially now on your birthday. Happy birthday again, with us, to us. It's great to have you. Keep up the good work with JuliaHealth, and to all the listeners and viewers at home, I hope that you enjoyed this episode as much as we did.
Oh, are we singing this one off?
Oh, you can do, yeah.
All right. Well, thank you. It was my honor, honestly, being here, guys. I really appreciate you taking all the time to reach out and we can chat about things. I really appreciate it. And
I think we'll need to have another chat as well. Yeah.
all right. Well,
Ciao.
thanks. So
see you at the next episode.